Over the last 24 hours, we identified 764 new cases of COVID-19 and completed about 14,000 tests. Our positivity rate currently stands at about 5.4%. We have identified 191 additional cases of variants of concern. Variants currently represent about 21% of our active cases. There are now active alerts or outbreaks in 365 schools, which represents 15% of all schools in the province. There are now 294 people in hospital being treated for COVID-19, including 55 in the ICU. 3 new deaths were reported to Alberta Health in the last 24 hours. My condolences go to the loved ones of these individuals and anyone who is mourning a death right now. We've talked before about the importance of using multiple indicators to make sure that we're getting the full picture of what the situation is. And we need to be looking at our new case numbers, we need to be looking at our positivity rate, at our RT value, or that growth rate of new cases. Obviously, variants are also an additional metric to watch, but there's no single metric that will tell us when we need to implement something or not. We need to be looking at that overall picture and a combination of all of those factors before we're able to make good decisions about what kinds of things may be necessary. The tip over to variants becoming the dominant strain will likely happen at a regional level first before it happens at a provincial level. And while I don't have the specific numbers in front of me right now, certainly one of the things that we're watching is those regional trends to see where the cases are, variant cases in particular, are rising more so than in other places. And ultimately, again, the importance of variant cases becoming that dominant strain is really just about the impact that has on growth, the impact that has on hospitalizations and ICU admissions. And so the variant by itself is not, again, the only important metric. It's all of those metrics put together. The question of virtual learning versus in-person learning has a few different aspects to it. From a health perspective, what we have seen is that when cases are high in the community, when we have high community transmission, that can impact schools with respect to exposures that happen. To date, throughout the course of the last year, we have seen that the precautions that are in place in schools mitigate the chances for the virus to spread. So while there is some transmission, we aren't seeing large outbreaks. So from a health perspective, that's not something at this point in time that we would be requiring. But of course, there are other perspectives that would need to be taken into account. And so again, the decisions about whether or not students would be learning virtually versus in person would have to be made based on all of those different factors. But from a health perspective at this point, again, schools themselves aren't seen to be a significant issue. But what we all need to do is minimize community transmission to keep schools and other settings safe. In November, December, as you may recall, we had our peak of active cases in December with just shy of 2,000 new cases in a given day, as well as in late December was our peak of hospitalizations with just shy of 1,000 people in hospital receiving treatment for COVID-19. While our case numbers certainly are concerning at the current time, we're not seeing again that same extremely high peak, and we are encouraging people to not travel over spring break, to not gather with people outside their household. And the impact, again, of people's decisions is going to be that's going to determine whether or not we need to consider new restrictions in the future. So the choice of whether or not to keep kids home for that week, again, is about a few things. First of all, we are seeing lower cases, lower hospitalizations at this time than we saw at Christmas. And second of all, again, we're not seeing that same significant school impact that we had just before the Christmas break with respect to the total number of students and teachers who we had out on quarantine or isolation. And so again, what I would say is the choices that we make now and in the coming weeks, that is the only thing that will determine our future. And and making sure that we're following the public health measures every day, that's what's going to make the difference, not necessarily whether or not we keep kids home for the week after spring break.